Good afternoon and welcome to this, our 7th webinar, our digital discussion, all about the Prevention Concordat programme for better mental health. My name's Richard Taunt.
I'm Anna Howells.
And my name's Lily McCurra.
And we're delighted to be joined today by Mark Doherty from Cleveland Police in our discussion. This is the second of our special Viewers' Choice webinars, where we sort of put the call out as to what were the topics which our audience most wanted to talk about, and the role of the blue light services, so fire, police, ambulance, search and rescue. I've been told not Coast Guard, search and rescue.
Oh.
Yeah, I've been advised. Mark has reliably informed me the role of these services in promoting good mental health across an area and within their organisations crops up a lot of our events, and so it's great to have a chance to talk about it in with slightly more time to do so. We're sorry that we're starting slightly late this afternoon, and we look forward to about 50 minutes of discussion. So I think we're going to start with talking a bit about the overall context, then the French Concordat, and then come over to Mark. But really, this webinar, as per other webinars, is all about discussion and debate. Anna, how can people get involved?
Yeah, there's 3 ways you can join the discussion today. You can post a question using the question box facility. You can email hello@kaleidoscope.healthcare, or you can join the conversation on Twitter using #PreventionConcordat.
Excellent. And if everyone's tech, well, not everyone, someone's tech suddenly fails, let's hope not everyone's tech fails.
You should definitely panic. No, you should definitely not panic. We will be recording this webinar and posting it afterwards, so you can view it then.
Excellent. Thank you very much. It's worth saying that these webinars are part of a series of events led by Public Health England, supported by Kaleidoscope Health and Care. That's us and the Centre for Mental Health. Lily, this Prevention Concordat thing, what is it?
Yeah, so the Prevention Concordat is really getting everybody to focus on the prevention of mental health problems and the promotion of good mental health. The new thing about this is actually what we're doing is we've given everyone a bit of a framework so that organisations, whatever your discipline, whether or not you're working in the local authority, NHS, blue lights like today, or voluntary sector, or even in business or employers, can actually think about how they can play their part in making sure that we improve the nation's mental health. So what we've done with the resources that have been put out by Public Health England is help explain to everybody how you might put the jigsaw together, what everybody's role is and how you can collaborate to make a difference. And with the learning events, and we've had the advantage of working with Kaleidoscope on this, what we've really wanted to do is to share examples, to really think together about how we make this a practical action. And we've already started to see some really good examples in different parts of the country that are already showing how you can make the change, both in terms of, as organisations, as areas, and as individuals, and as all collectively working on improving the public's mental health.
Lovely. And Lily, we've talked about these very much as executives say, as they're learning events.
Yeah.
They're not entitled masterclasses where we tell you what to do. And it's been lovely to see that peer-to-peer sharing and learning.
Yeah, it has. And what's been particularly exciting for me is that, we've really seen things like, evidence-based and intelligence-led decision-making really coming to the fore. So, gone are the days of people kind of really just wondering where to start. Everybody is doing something around the country. But again, some areas have already started to, make a bit more of a sophisticated piece. And again, like today's example, we're going to be talking about, again, how, you're not the usual suspects are also already actually leading the way.
Excellent. Lily, there's a lot of logos there. Do you want to just explain what they're there for?
So obviously, with a brand new initiative we launched at the Public Health England conference last September, is that what we knew from the beginning, it was really important to make sure we had nice Department of Health, some of the key mental health organisations like Mental Health Foundation, Centre for Mental Health, Children and Young People's Coalition, as well as Local Government Association, the Association of Directors of Public Health, you name it, they're there. And we're continuing to add to that list of people. So we've now got 35 national organisations signed up. We also have our first 6 local areas, again, who've also signed up. So that includes County Durham, Derby, Redcar and Cleveland, as well as Middlesbrough, Hertfordshire as well. So again, we're just showing that this really can happen.
Hertfordshire flying the flag. Well, you don't have to be in the north.
No, you don't have to be in the north. Yes.
Regardless of what Mark might tell us in just a minute. Lily, thank you very much. And for those of you who've joined previous webinars, you'll be aware that the planning resource, which came out last August, September, as Lee said, are structured around these 5 domains, which we, Republic of England, saw as key to effective planning for better mental health. So we've covered off 4 of these in previous discussions. We've got one more on item 3, translating need into deliverable commitments, which is actually our next webinar. This one.
It is. It's on the 23rd, but same time, 1 till 2 p.m.
So if you're wanting to catch up on any of those, you can do so, and you can even register for future events. Just go along to preventionconcordat.com to watch back previous webinars, catch up on blogs from the face-to-face events, and also register for the remaining events. We've gone from Plymouth to Durham, Bristol to, we're going to be in Cambridge.
Yeah, it's a bit of a star around the whole of the country. So we've made sure we've actually been to every region, or so it's actually been relatively easy for people to get there. But you know, again, last week we had Plymouth, so you know, we've got colleagues from right the way from the forest reaches of Cornwall. Again, when we were in Durham, we had people from Northumberland. We've done similar when we land in Liverpool. We've got quite a lot of people who've come from Cumbria and other places. So again, we really enjoyed that experience of again, that joint learning, and also being able to then, you'll see both in these sessions, but also in the work that Public Health England does over the next year, that we're taking that learning so that whether you're living in a rural area or a city, you'll be able to use this information to your best advantage.
Lily, thank you very much. And just to make clear, we're not going to do some league table of all the places we've been to and who is the friendliest, who is the most active. That's not coming unless we're offered extravagantly large amounts of cake, and then we might reply to that. So yes, please do catch up on past events. Sign up to face-to-face events if you have not done so yet. So today, we're talking about the role of the emergency services, and as I said at the outset, it's an issue which has cropped up at a range of events we've had, both in terms of the role of emergency services as part of a community, as part of a range of organisations supporting the population, but also what emergency services can do as employers working with their staff. And it's going to be a particular focus on that, which we're going to have today. So Mark, over to you. Thank you so much for joining us and talking through some of your work in Cleveland.
Thanks. Cheers, Rich. Thanks for the introduction, and thank you for inviting me. You've hit the nail on the head when you said there are 2 sort of aspects to policing. One is this day job, this very stressful job that people embark upon, and the other one is dealing with people who are suffering from mental illness, and of course in the community, everybody throughout on the mental health continuum. So we focused this on the internal side, and how we do what we like to call the blue light support network, and it's how we support staff, etc. I shall go through how it started, if that's okay, with the why us slide. We'll talk about this chap on the left, if I may, first off, wearing his rather bright life preserver. This is Phil Spencer, and Phil was instrumental and is the powerhouse and a real passionate figure about driving this in Cleveland Police. Phil and I both had our own experience of mental ill health within the police service. We've both been there, different sets of circumstances, both very personal, both being affected, both suffered with mental illness, both been through it, come back, and perhaps strongly we can both talk about it now. We both talk about it quite openly, and that's potentially down to the characters we are. We've been subject to the stigma. The police is has been a very archaic, patriarchal organisation, and mental ill health was never a talking point until very recently, and now it's very much coming to the fore as we open up and we're sort of more transparent about it, more prepared to talk about it. When we've been there, when we've been unwell, we've noted that there were very few opportunities within the organisation. There's often a welfare officer who you could talk to, but formalised routes such as counselling, and certainly nothing in terms of the Blue Light programme. You felt very lonely, very exposed within the organisation. So we saw the need to bring this into the organisation. We've seen the worst and the best that the job can expose you to, and again, that's a reflection on the job itself and its it's that reason that people join. It's the chasing burglars down alleys. It's the driving a car with blue lights on through the junction with the red lights, and it's the thrill of catching someone. But there are other sides to it. There are those incidents where you attend other people's sudden deaths, and that incident where someone stood atop a car park and wants to harm themselves, that incident where you walk in and someone's already harmed themselves. And we've seen all that, and we've seen how that affects individuals within the organisation. 1 in 4 police officers will experience some mental illness at any given time. And we're not doing it because it's a cynical way of reducing sickness within the police force. And this is very much about the tagline, looking after each other. It's what we do. It's less about reducing sickness. It's about providing those enablers for the way out to prevent sickness becoming an issue for individuals. Personally, my little journey, which is on the next slide, is it's a why me. I was that blue light chasing burglar, running after, have a scrap when it was necessary, gung-ho type cop. I'd set my stall out to do everything I possibly could to be this great cop, having joined. There was a masculinity about it, sort of expected from the organisation. There was very much a stigma, where there was talk of people who weren't in the workplace being on quote-unquote happy pills, etc. There was certainly no support mechanisms in terms of counselling and visible presence, posters, screensavers, etc. And it dawned on me that we're subject to a lot. We're subject to the stresses like most people are in modern life. But add on to those stresses of the jobs that I've mentioned, the nice jobs, where you're chasing after someone, you don't know what they've got on them. And it's sort of an adrenaline rush. It's that chemical cocktail releasing stuff into your body. And it's only when you come out of the other side and you get that time for respite and that thought where it's like, oh, could have gone wrong there. Or you're driving the car with the blue lights on, you think, oh, there, but for the grace of God, I didn't have a crash there. Shift work, very impactful on the circadian rhythm, very impactful on mental well-being. Something we have to do, 24/7 service, but nothing in place with regards to supporting people who may be suffering as a result of the shifts. Historically, and I will say it's getting better, but there was always an element of the old boys network, an element of bullying within the organisation. That's being addressed and taken on, but that affects people. People perceive a lack of opportunity, people perceive themselves as being victims, and then spiral into that further and further. And some of the incidents you deal with, because they're not always the chase, catch, burglar, etc. And there's a real risk of exposure to those incidents which would leave you with post-traumatic stress. And that's the nasty road crash, but it's everything that pushes everybody's buttons. It could be the sudden infant death that you attend. It could be any manner of incidents. The one incident where you put someone into a van and you search them as they're going in and they've got a knife on them, and you flash with that thought that, whoa, that could have turned out very differently. And it just provokes those thoughts, and it provokes, and some of those, they affected me, and they pushed me on my journey, and I went through it, and I'm out the other side, and I'm very, very proud and open to talk about it, because I felt that stigma, and I want to change it, and that's the direction that Phil's coming from. So we introduced the Blue Light Programme in Cleveland in association with Mind, and looking after each other was chosen as the tagline. It isn't an organisational down-over, you will look after people with mental health to reduce sickness. It is a grassroots-led, voluntary group of champions who promote better mental well-being in the workplace. And we're doing that across the Northeast with other blue light organisations such as Search and Rescue, the Ambulance Service and the Fire Service. And we're sharing that wealth and knowledge so that we can help people who need help. Some of the stuff we're doing is on the next slide, and it's very much, there are some aspects of this, so fundraisers, etc. And I've noticed that my fonts haven't all embedded properly, so I apologise for the Times New Roman hanging over the edge. Things like the Blue Striders, who are a walking group, and that link between physical exercise, company who know where you're at, so you don't have to defend that stigma, you don't have to hide away, and just go out and do 12, 13-mile walks as a group. We do the Blue Lake Walk, which is a cross movers walk, about 35, 40 miles as a group, just to raise awareness. We've made sure that we do obtain a little bit of funding through cake stores, etc., with all of our literature behind them. I'll come on to those in a bit. The training is something that we're very specific on. Everybody's a volunteer, and some of the training's been very deep. Some of us have done suicide intervention training, etc. There's also mental health first aid courses that we've undertaken, and there's also the speak out training that we've done. All of the volunteers get a mixture of training, so all of our champions are in some way offering something to other people. And we start early. We now have an input on the course of every set of probationer constables and student PCSOs who come in, and we go in and we explain to them about our blue light, about how we support people, about it being looking after each other, and we give them tips on managing themselves and interacting with others, something that was never there formally previously. And of course it opens up the avenues to us should we need to provide a champion or to provide some direction. It's very much the ground up, as I said earlier. It's not driven by the organisation. It's welcomed by the organisation, but it's not driven by the organisation. This is about the champions, the efforts they put in, the passion of Phil and the other people around it who want to make that difference to people. And we have got some interesting times, interesting changes, something that you wouldn't have seen in a police office sort of 5, 6 years ago. We've got some dedicated blue light quiet rooms where we can put some resources, we can give people some time out, we can let them go up there with a champion, we can have perhaps that cathartic release that prevents them building stuff up. Perhaps it's a little bit further than that, perhaps we can go in there and do some signposting, but I think it's significant that these are now forming commonplace inside the buildings of the organisation, where previously that wouldn't have happened. It's a real step forward in recognising that people do suffer from mental illness and deviations from the job that's been imposed on them. And of course, in the bottom right hand corner, the next slide is Blue on the Loo, and there's a selection of posters there, and this was a real first step in terms of bringing mental health awareness to the organisation. The thought process was that everybody at some point needs the loo in a given month. I hope people need the loo in a given month. So people will always see these. So they are on the back of cubicle doors in all of the loos. And for the gents, they are atop every urinal at eye height or thereabouts, so they can't be avoided. They serve a number of purposes. As you can see from the selection there, we will often advertise events, so Time to Talk Day, Mental Health Awareness Week. We'll advertise our own events, our own internal events. We'll do some signposting to support services where we can. We'll dispel a few myths, and a key facet of this is that we really want to smash the stigma around mental health, particularly in what is essentially still the tail end of a patriarchal organisation where it wasn't even acknowledged. So if we can break that stigma, if we can get people to open up and understand that we're there, all the better. And other posters will contain perhaps a quote of someone who's been somewhere, someone who's done something, someone who's experienced mental health, and they've been able to open up, talk about it, and perhaps give some advice in a poster, in a quote. And we also like to make sure that we give sort of 10 tips. So once a month, it'll be 10 tips for better sleep, and 10 tips for reducing stress. And they're always there. Change, and a key aspect is they're changed every month. So we are passionate. We're not going to let this stagnate. This is our baby, and we make sure we're on top of it to give that message out every month. It's there, and it changes. Keep it rolling and start the conversations. Start opening those communication channels, even with those who've been previously hard to reach. Every poster has that tagline right there, looking after each other. And that's what it's about. It's, as I've said, it's not about having a specific department, a specific individual who will provide you with all the succour, the counselling, the signposting, that cathartic release. It's about everybody providing that for everybody else. And the champions do a fantastic role. And as we break down the stigma and we talk to newcomers to the organisation, we really ensure that everybody's capable of supporting each other on the mental health continuum, about providing people with that way out and that ability to talk openly and freely about what's affecting them.
Mark, thank you very much indeed. Inspirational walkthrough of your work. I'm sure there'll be lots of questions and discussion. Mark, thank you very much indeed for sharing your experiences. Anna, how can people get involved?
Yep, 3 ways to join the discussion, either using the chat box facility that's on your screens, emailing hello@kaleidoscope.healthcare, or tweeting us using the hashtag #PreventionConcordat.
Thank you very much. And if you are watching this live, please do send through questions. If you're watching this via YouTube, probably you're going to struggle a bit trying to find that ask question option, but we'd still love your reflections either by email or do tweet about it as you go through. Mark, we'll come for questions discussion in just a second. But Lily, sort of your reaction to Mark's fantastic presentation. Thank you again, Mark. A lot there, both as Blue Lights, but also in terms of what any organisation can be doing to support better mental health.
I think it's a phenomenal achievement actually, because it does also demonstrate, going back to the thing of that, that idea that comes from one person's head that kind of just wonders, I wonder if I could change something, informed by their own, whether it's informed by their own experience or things they've seen in colleagues, and actually look how big this is and how how transferable it is as well. So again, actually lots and lots of sort of credit to that. And actually, so I mean, again, I think it also demonstrates as well, once an employer also kind of gets behind something, actually there's a value both for the employers themselves, as in suddenly you start to make an organisation a place where people might want to come and work. So you've got the people who are already there benefiting, but also people might be more attracted to come and work, more attracted to stay. And then what we haven't talked about a little bit, but we might talk about as we go on, is also the knock on to this is all about us as well, isn't it? So it's about those people who are employees, the benefits to the family and benefits to the wider community as well, all through this intervention, which is just shows what can be done with what seems like an acorn, and here and the classic oak tree. And actually I kind of want to take the acorns and start spreading them around to other places as well.
And well, let's start on that theme. Can you give us a bit of a description of how big this oak tree is now, Mark? You've been doing it for a couple of years. What sort of impact have you seen from the programme?
There's been the cross-pollination to the fire service, search and rescue, not the Coast Guard, and the ambulance service. And personally, from inside our organisation, and without naming cases, we've been able to signpost people at varying stages of their issues. We've been able to talk through them and help them go forward from that. Everybody seems to be sharing the blue on the loo idea and talking positively about it, and I think that's something that's really could be shared and prevalent throughout a lot of organisations, as long as it's not allowed to stagnate, as long as it's fresh every month and it's that eye-catching, real heavy hitting. Here we are. We're not going to change. We're not going to go away. Let's break the stigma. Let's talk about it. We do a lot of work with Mind up here. We're part of the Northeast Blue Light UK.org group, where all of the emergency services up here talk to each other, and we share ideas, share funding, etc., in order to progress for better mental health across. And I think what Lily hit on is a good point. This is also about service provision to the wider community as well. So better mental health in employees and better learning around mental health, mental unwell, gives us that ability, that extra facet to dealing with people in the community. Because previously the police have always been quite staid in the powers that they can use in the community. And they've never been particularly nice, as I'm sure we've seen in the press. It's taking people away, it's depriving their liberty when they're a danger to others. And sometimes we go to these incidents where people just need a bit of help, a bit of signposting and a bit of support. We can now offer that. there's some great organisations out there, child bereavement organisations, for example, who not only deal with people who've lost children, but children who've lost adults. So we come across youths who are perhaps involved in criminality, and we can direct them to these organisations where they can obtain the counselling that's perhaps led to their behaviours and the cycle of sort of self-destruction that they find themselves on. And it's a real boon to walk away and to know that you've had that impact on someone and potentially saved or changed a life.
Mark, thank you very much. Anna, have we got questions starting to come through?
We do. This question's from Daniel. Thank you very much for this one. And the question is, Mark, you described this as a grassroots project, and how important is that? And would it be damaging, do you think, if it became organisational led?
The question would be, and it's hypothetical, would an organisation do it to reduce sickness numbers and therefore lose the personal touch? So very much grassroots led. Phil and I take a lot of time in our own personal time to do Blue on the Loop posters, campaigns, etc., screensavers for work. We also take a lot of time out to talk to individuals who are suffering with symptoms of mental illness, and to break the stigma as well, and that's a key facet in the police. You know, we use this, we use a briefing every day, and we can often get a bit in about breaking that stigma down there. If it was organisationally led, would it have the passion? I would imagine not, and that's no disrespect to the organisation, but organisations find it very hard to translate to the personal. And I think having made that journey, having been that person, the ability now and the strength I've found to talk about it and to open up and to reduce the stigma, and that's my passion and Phil's as well, and all of the other champions, I think it has to be retained at grassroots. When you formalise something in an organisational sense, you tend to lose the volunteers, the champions as they are now, and that will be a significant loss.
Mark, thanks. And Daniel, great question. Mark, so just to get that straight, do you do all of this out of your own personal time? This isn't actually part of your formal job, is that right? Or you support a bit?
No, that's correct. I am a sergeant. My day job is a sergeant on a neighbourhood policing team with 10 staff who all require my time at work. So yes, it's all home based.
I thought you were going to say who all go to the loo, that being a key feature. I'm sure they do that too.
They're often my test bed for the new Blue on the Loo, I must admit.
Mark, thanks so much. Anna, more questions?
Yes, thank you, Adrian, for this question. Adrian asks, do you see when a colleague is just beginning to get into difficulties, and do you then proactively intervene?
Great question.
Yes. And again, I would never disclose cases, but over the past 12 months, I've made 3, and other champions have made referrals where this has happened, and that's a key aspect of what the champions do. The champions are out there, they're working with people, they're in the workplace, and they're looking out for those signs of, you know, someone's struggling, someone's not too well, and they're able to provide, first of all, that conversation start. That's so hard sometimes, you know, and we sort of push these 3 words. How are you? How are you? How are you? And they're really impactful when you take it out of the context of I'm fine, or when you have that little bit of training to look beyond, yeah, I'm fine, just tired, a bit snappy, and you can really take it forward. So yes, it's a very proactive thing that the champions do.
Okay, but so that, and that, it sounds like a key part of this is how you work with those partners, sort of with Mind and others, so you do have places to refer onwards to, rather than trying to just deal with it all in-house.
Yeah, absolutely. And historically, the police haven't done very well. I imagine other organisations within the blue light arena haven't done particularly well managing mental well-being. We now build up a network of referrals. We have also got a network of alternative therapy providers, so we can refer people on to what suits their needs, be that bereavement counselling, be that a holistic therapy, that they're just stressed. And it's a horrible word, but it's a very, very effective word to describe what some of these roles, these occupations do to people. And sometimes to give them that out where it isn't formal counselling, where it isn't going with them to a doctor's, where it isn't identification of their symptoms, and it's just an ability for them to lose some of that baggage that work imposes on them, is a key facet of what we do. And we have that network and that directory to point people to.
Lovely. Mark, thanks so much. I know that there are questions queuing up, and I've got a list of about 156.
Yeah,
So
I did just want to say very, very quickly, just on the thing about the grassroots, because I absolutely believe that, yes, the staff ownership is really important, but again, I think employers can still play an additional bit, which is even if it's simply the sponsorship of saying, yes, it's okay to put something in the toilet, because actually some places, you know, even just that takes a lot of getting permission, so there's consents to allow things to happen. And also we know that one of the most important things for a lot of people is also having a good line manager. So that's one thing, that a good line manager, good line management training, which isn't necessarily absolutely about mental health, but it helps make that conversation and the types of conversations such as how are you actually land well, so that everybody's doing something, and then the champions are doing more on top and have got a bed to build on, really, I think, as well.
It certainly sounds like that there's the classic thing in any, particularly any NHS change program, is that we bang on a lot about it's all about leaders. It's all about leaders, and possibly I think often we don't give enough credit or agency to people like yourself from the grassroots who just say, no, there's something which I can do as an individual, which actually is really difficult for an organisation to do, and how you have that personal touch. You put it, I think, really important. That's one question I'm going to throw in quickly, and then come to more, which is, Mark, it sounds like a really powerful part of what you do is just being a role model for people in your team and sort of people across the force, that it's actually okay to talk about mental health and experiences, and still be really good at your job. Do you see evidence of change, of people being more willing to have conversations than they might not otherwise have been when you started your career?
Absolutely. And that's to come back to what Lily's mentioned, is that it is sponsored by the organisation, and we've got some great, we're still a rank structured organisation, so we've got people with lots of stuff on their shoulders who will who now sponsor us, who now identify that the work that's being done, and give us that freedom. We can give inputs at leadership courses, etc., but the greatest facet is just the ability to have that conversation, and it's demonstrated in the fact that people now come to us. People will seek champions out, will seek individuals out, and say, do you know what, any chance I can have 5 minutes? And that's a real boon. That's instead of identifying the issue as it starts to manifest itself and then intervening as a champion, we're bringing that culture of, can I have a word with you? Any chance I can have 5 minutes? Can I start this conversation? And it's marvellous to people to come and say, I've got something that I think you might be able to help with, not necessarily the job. And you can start that conversation, start that process. And that's really knocking down some barriers all the way through the organisation.
Well, really nice to see you. Thank you very much. Anna, questions?
Yes, we've got a comment and a question from Lynn, so thank you, Lynn, very much for this one. And Lynn says, well done, Mark and co, amazing efforts inside an organisation that needs so much support from all stakeholders in the health and care community. Signposting from the beginning for new staff is great. Being realistic about what you may face in the new role will be scary, but knowing where you can access support is clarity. And grassroots is the best way. But Lynn wonders if the local police boards are involved or aware of the programme, and is there a lead board member to support you in your efforts?
I'm going to assume what she's referring to is the PCCs, the police chairs, who run alongside the chief officer. Just to give you some clarity, they run alongside the chief of police, and the chief of police is responsible for policing, and the PCCs are responsible for the other aspect of the business that we do. And yes, there's buy-in, and we have members from the PCC's office who are champions, and the PCC is more than aware of it, more than prepared to contribute to the cause when necessary, and a big supporter of it.
And again, just getting that to grassroots and organisational, I don't want to say levers, but aspects working well together sounds like a key part. Another question from me, and then Lily, I know you've got other questions you want to throw in. But Mark, I'm really interested by how you're doing this as sort of a blue lights network. It's not just the police. You are thinking sort of across the different organisations. Have there been instances where you've had something which has really worked sort of within the police, which hasn't translated quite as well into those other contexts? I imagine you're dealing with similar sorts of experiences, but sort of quite different quite different roles in some cases. So not everything's going to work just by cutting and pasting.
No, absolutely not. And it's that dialogue, it's that sitting together and working out, and it's that throwing of all of the ideas into the pot so that people can take their experience of their organisation and tailor it towards what's going to work for them. And I think being open to the fact that your idea, as precious as it may be to you, could be tweaked, could be changed, but could be made more appropriate for the same aim. And I think it's about the aim rather than being precious about the product. So within that, we deal a lot of search and rescue of volunteers. The ambulance service have their own pressures at the moment in time. The fire service with different regs, and they get sort of physical fitness built into their working time, which contributes to mental well-being, etc. So it's about perhaps something where the police wouldn't necessarily be able to provide that support where other organisations could, or perhaps where other organisations couldn't, and we can come in as the police and say, actually, do you know what, we work together and we have these seminars together and the champions get together, so can we signpost you or can you signpost us? It's very much a very open discussion, but tailored to organisations so that we properly fit together.
Yeah, again, we come back to conversation being so key. Lily?
Yeah, I mean, I was actually just thinking there as well about the value of a focus on the nature of your role, because again, I mean, conversely, with across the blue lights, you've got, you know, sort of fire and rescue, who are, I think they still rate as being the most popular public servants through to
missed the opportunity.
Yeah, they always win that award. So actually, again, actually as well, you know, they've got their pressures, but actually in a sense, they're kind of, they've also got the sort of lot of public support, and therefore actually their ability to explicitly take some of the mental health messages out to communities is possibly sometimes easier, or actually it needs to be built in, but we need to work through that. And then I think there is possibly an opportunity that I'm curious about, and actually I have to say, Claire, I'm still thinking about, is that, you know, there's probably a role as well to the police in that as well, because obviously you've already been doing a lot about, you know, the crisis, preventing crises happening and intervening very early with crises, thinking about the public here. But there is, again, is possibly as well something that we could do together through this, which is about changing the perception of the police as well. I think, you know, again, that actually, you know, that actually they are, you know, you have a really important role in society, and again, that being part of the general cultural changes to what Prevention Concordat is about overall.
Yeah, and I think that's something that we work towards, and it's incumbent. Not getting emotional, sorry, I just dried up a little. It's incumbent on individuals to take that message forward. So initially it's about empowering them and making sure that they're comfortable and capable of giving out that message. But yes, it is. It's about, once we've got to that point, it's about going out and providing that message. We have the issue that the police predominantly deal with people who've reached crisis point, unfortunately, who've gone so far down that line that they do want to harm themselves, that they are atop a building, that they are, you know, in overdose, etc. To provide that image of the police that we're not just there for the bad things. And perhaps this is where we lose out to the fire service, because the fire service won't give you a ticket, they won't lock you up for being drunk and disorderly, etc. We're obliged to, and they come out as very heroic with the carrying on the shoulder, and very often if you're being carried by us, it's with handcuffs on. The key would be to just having, and again, it comes back to conversations, but being prepared for the conversations and breaking down that stigma about talking about it. To hear references to happy pills and people being quote unquote crackers, it just makes you want to say, look, hey, hang on, do you want to have this chat and sit down and talk to me? Be them in the community, be them within the four walls of the police office, be those other blue light service providers. I think it's about sharing the education, the experience, the mouth, just the ability to talk and the ability to listen.
Yeah. Mark, thanks very much. We've got about 10 minutes left or so. So, Anna, do you want to recap on how people can join the discussion if they've got any last minute questions?
Any last minute questions, you can either post them in the question box facility, you can email hello@kaleidoscope.healthcare, or you can join us on Twitter using #PreventionConcordat.
Lovely. And is Blue on the Loo a hashtag as well, Mark? Is that one?
Certainly is, yes.
Blue on the Loo. Okay, use that one as well if you would like. Excellent. Anna, questions?
Yes, we just had a question. Mark, you mentioned earlier some of the training that either the champions can get involved in or other staff. And could you just kind of recap on how those champions are trained or what's on offer?
Yeah, certainly. So there's an initial input to be a blue light champion, which is an overview of impact factors on mental well-being in the organisation, on individuals, and they're perhaps what you might expect to see in terms of stresses, shift patterns, etc., specific life events, a description of overall conditions, so PTSD, depression, anxiety, stress, a breakdown of all of those so that people are aware of symptoms they're looking for, a symptom checker, if you like, and obviously all the documentation around signposting, and a large proportion of it is about how are you? That conversation starter and being able to initiate and break the stigma and pass that virally. There are also the speak up, speak out inputs, which are about reducing stigma again. There is mental health first aid, which is a formal course and undertaken by the champions, so they can provide that intervention at the point before it gets to crises, but also taking it up to crises point. Some of us, there's some suicide intervention training, so some of us have done the assist course, and there are other suicide prevention training courses. And wherever that becomes available, wherever further training becomes identified by any members of the blue light team or anybody in the organisation who thinks it might contribute to the work we're trying to do, we'll look into it and we'll scope it out with a view to getting as many people trained as we can.
Great. Mark, thank you again. 8 minutes left or so. Final questions, please send them through. One more from me, if that's okay, which is, you talked at the beginning about how this came through sort of your work and also with Phil Spencer as well. So both of you having had sort of personal experience, how did you go about articulating the sort of the nature of the experience you had to people who hadn't had similar experience? How did you sort of make it something which they could relate to if they hadn't possibly been through that experience themselves?
Whether it was my experience or my personality, I'm incredibly honest and open about it, and I try to impart that to everybody else, and I know Phil does. I don't think there's a place for us to hide away, particularly when you're trying to affect other people who may be embarking on crisis or illness. And it is literally that I just don't mind speaking about it quite openly, quite honestly, not with a view to retribution, but I do find it cathartic to get that release, but I also find it opens other people up immensely. Yeah.
Again, that role modeling point might be really important. Anna, questions?
Yes, we have a question from Adrian. Thank you, Adrian, for this. So he says, Mark, as an aside, I've heard estimates that these days 35% of daily police work involves people or members of the public who have mental health issues. Would that be your experience?
A large proportion of the people I deal with, and within that, I think I'll also add dependency issues alongside mental health, because they often go hand in hand. Yes, yeah, and it's about being able to provide a service to those people in line with their expectations, also to get them back on track where we can. And don't forget that within the legislative stuff, when people go to court, we'll also look to get them into treatment, etc., within the work that we do. So if their offending is being fueled by a mental health condition, if their offending is being fueled to get drugs, as is often the case, then we'd look to get them into treatment and to help them embark on that journey.
Great. Adrian, thank you very much for that question. Lily, a question for you. It's a fantastic example here about an organisation wanting to approach, through Mark's work, but sort of taking a different approach to promotion of good mental health. What are the sort of resources which, say, employers could draw upon to support a sort of more proactive mental health approach within their organisation?
So there's a range. So, obviously we've already mentioned on the fact that there's a whole suite of prevention Concordat resources, but there's also a programme of work that Public Health England do, which is about, with business in the community, which is about making sure that all employers are better at, supporting their staff's health and well-being. And there's a subset within that which are about mental health and well-being. So sleep, good to hear that was mentioned today. There's a whole kit on that. And again, that takes everything from you know, supporting people and engaging people who are on shift work through to sort of more standardised office hours, through to things about physical activity. Again, good to see that mentioned as part of Blue on the Loop, both as being more physically active for your physical health, but also as a prevention, support and treatment for, you know, a range of issues, including mental health conditions as well. So that's they're there as well, and they're both downloadable, and again, you know, kind of sort of PDF format that you can use. But I'd also point as well, particularly where, you know, we've got quite a large adult or well, middle to late age adults, is the things like the 1U resource, which again, you know, people can use in their own home, which looks at, you know, lots of the, you know, 4 key areas of people's of life where that, you know, people can make changes either, you know, at home or at work. So again, that's sleep, stress, alcohol, you know, sort of diet, and again, you know, allowing people to make incremental changes and encouraging that in the workplace as well is a really a good thing to do, all looping back to supporting people's mental health and well-being.
Thank you very much. Well, we're almost out of time, and so just checking any final questions.
There's one final comment.
A comment.
Sharing of work. So thank you, Lynn, for this. Who just wants to share about the Headspace app that NHS staff use and they find really helpful on a day-to-day basis in between the conversations that you have about mental health.
Thank you very much. We are almost out of time. So in time-honoured fashion, we'll just finish by we'll go around here and up in Cleveland. With just one key reflection from our discussion, and thanks, well, Mark, thank you to you, but thanks to all who have joined in. I think what's been a cracking discussion, so thank you very much indeed. So one key reflection from our conversation. I'll go first just to buy my colleagues time, but if you go myself, Anna, Lily, and then Mark, you'll get the last word. But one bit of detail which really stood out for me was your point, Mark, about not letting things stagnate. And so it's not just putting it up in the loo and going, great, well, that's job done then, but how you refresh it and how you just give that message that we're not going away. This matters, and we're going to keep on going on about it. I thought it was really, I think there's lots of ways which that could be thought about, lots of different settings. Really nice point. Anna.
I really liked Mark's points about the dual approach, so the importance of addressing mental health issues, but also the importance of addressing stigma around those issues.
Lily.
And mine is that, you know, I think what this demonstrates is that we all have the potential to be a role model or a champion, and this is an example of, you know, almost, you know, star example of actually how something's been taken from being that kernel of an idea into something that is, you know, sort of star quality and also, you know, really transferable. So kind of really by that too.
Really, thank you. Star quality is a little quote you can put on the bottom of the Blue on the Loop posters.
I like that.
Mark, reflection.
Being part of it, but formalising it in this arena, I think I would have to go to the old Bob Hoskins of "It's good to talk." Be that with peers, be that with colleagues, be that with other organisations. Let's make it viral and let's keep talking about mental well-being.
Lovely, Mark. Thank you very much indeed. Everyone's now going to have Bob Hoskins in their head for the rest of the day, which is great. Mark, thank you once again. Just to say, in terms of upcoming events, so the recording of this discussion will shortly be available for sharing for your friends and family. We're then in Birmingham next week. Our next digital discussion, Anna?
Yeah, the 23rd of March, 1 till 2 p.m, focusing on translating need into deliverable commitments.
Who's joining us for that one?
Jim McManus is joining us, and Christina Gray, I think, as well.
Great.
Yeah,
that should be a great
stars
discussion. more of this galaxy of stars. We then finish the month. 27th we're in London, 28th we're in Liverpool, 26th of April we're in Cambridge, and then we're going to have a final digital discussion in early June just to reflect on the whole series of events, including this one. So very much hope you can join us for those. Preventionconcordat.com is where you can sign up. So I'll just say thank you once again for joining. Mark, thank you again for a cracking presentation and your honesty. Very much appreciated and really powerful messages. So Mark, thank you, Lily, thank you, Anna, and we hope to see you on a future discussion. Thanks very much. Goodbye.
Thank you.
Bye.